Did you know that 1 in every 6 men will develop some kind of prostate problem during their lifetime? And worse, most only find out when things have already gotten serious. The prostate is a small gland, but it has a huge impact on male health. The symptoms can start out mild, almost unnoticeable, but ignoring them can come at a high cost, in quality of life, in suffering, and in extreme cases, even in loss of life. That's why, in today's video, we're going to reveal the 7 early signs of prostate problems that every man needs to know and take seriously. If you're over 40, or if you have a father, brother, or husband in that age group, this video is for you. Don't forget to subscribe to the channel now. Leave a like and share this with someone who needs to hear it. Now let's jump right into the first sign. 1. Weak or stop-and-go urine stream. You know when you try to pour water from a bottle but it comes out slowly in little bits, or even stops in the middle? That can also happen when a man tries to pee, and many people don't realize the problem might be with the prostate. The prostate is a small gland that only men have. As men get older, it can grow bigger, and when it does, it can press on the tube that carries urine out of the body. That makes it harder for urine to flow, so the pee comes out weak, slowly, or in starts and stops. A lot of men think this is just normal with age. But the truth is, it's not normal. It's your body's way of saying, hey, something's wrong down here. If this problem isn't taken care of, it can cause urine infections, bladder stones, or even something worse, not being able to pee at all. So, if you notice your pee is weak or acting weird, it's a good idea to see a doctor called a urologist. They can do a quick checkup and some simple tests to find out what's going on. 2. Frequent need to urinate, especially at night. Do you wake up in the middle of the night with an uncontrollable urge to go to the bathroom? Does this happen 2, 3, or even more times per night? This could be one of the clearest, and most annoying, signs that something's not right with your prostate. This symptom is known as nocturia, and it usually appears when an enlarged prostate starts pressing on the bladder, reducing its storage capacity. The result? You feel the urge to urinate much more frequently, even if only a small amount comes out. The impact goes far beyond inconvenience. It affects your quality of sleep. It lowers your energy and concentration throughout the day. It can cause irritability, anxiety, and even depression in prolonged cases. Many men try to deal with this simply by drinking less water at night, but that's just a temporary fix. The real issue is the prostate, and it needs to be checked by a doctor. Studies show that up to 80% of men over the age of 50 report increased urinary frequency, especially at night. Keep track of how many times you're waking up to urinate and share that information with your doctor. It helps with diagnosis and ongoing treatment. 3. Feeling of a full bladder even after urinating. You go to the bathroom, you pee, but walk away with the clear feeling that you didn't empty everything. That uncomfortable sensation of a full bladder after urination is a classic sign that the prostate is interfering with urinary flow. This happens because an enlarged prostate can narrow the urethra, the tube through which urine passes. As a result, the bladder can't empty completely, and some urine remains trapped. The problem is that this residual urine can lead to recurring urinary tract infections, increase the risk of bladder stones, and cause constant abdominal discomfort. And you know what many men do? They ignore it, think it's psychological, or worse, they just get used to the discomfort. But be warned, this is not normal. This persistent feeling of urgency may be the beginning of something more serious, such as progressive lower urinary tract obstruction. Tell your doctor about this symptom in detail. He may order tests like urine flowmetry or a post-void bladder ultrasound to check for retained urine. 4. Difficulty starting urination. Do you feel the urge to urinate, But once you're at the toilet, you have to strain or wait several seconds before the stream begins. This difficulty in starting to urinate is another silent sign that your prostate may be partially blocking the urethra. It's like trying to empty a bent hose. The water is there, the pressure too, but it won't flow until the blockage gives way. That's exactly what happens. The enlarged prostate compresses the urinary channel, making it harder to begin the stream. And the more you push, the more tension builds in the bladder, which can lead to muscle complications and even loss of proper bladder function in the future. This symptom might seem harmless, but it usually gets worse with time, going from seconds to minutes and increasing discomfort and frustration. And worse, it can even be an early warning sign of prostate cancer, especially when accompanied by other symptoms like pain or blood in the urine. Avoid holding in your urine or straining too much. Track how long it takes for you to start urinating and seek medical advice as soon as possible. 5. Pain or burning during urination. Feeling pain, burning, or stinging while urinating is never something to ignore, especially for men over 40. This discomfort is a direct sign that there's inflammation or infection in the urinary tract, and the prostate may be the culprit. This symptom is often linked to prostatitis, which is inflammation of the prostate. It can be caused by bacteria, viruses, or even prolonged pelvic muscle tension due to stress. Pain while urinating may also come with pain during ejaculation, low-grade fever, pressure in the perineum, the area between the anus and scrotum, constant discomfort while sitting. Did you know? Prostatitis affects around 10% of men at some point in life, and many confuse its symptoms with a simple urinary infection. But here's the warning. Urinary tract infections in adult men are rare. When they do occur, it's a sign that something is blocking or irritating the system, and the prostate is the prime suspect. Pain while urinating is never just a passing thing. Consult a urologist as soon as possible. He may recommend urine tests, PSA blood work, and ultrasound to get to the root of the problem. 6. Blood in urine or semen. If you ever see blood in your pee or in your semen, even just a little, even if it happens only once, that's a big warning sign. This is not something to ignore. When blood shows up in your pee, it's called hematuria. When it's in your semen, it's called hematospermia, and it can mean things like an infection or swelling in the prostate, an enlarged prostate, or in more serious cases, prostate cancer. Sometimes the blood is easy to see. Other times, you don't notice it, but a lab test will find it. Either way, it means something is hurting the tiny blood vessels inside your body. 7. Pain in the back, hips, or lower abdomen. Persistent pain in the lower back, hips, or lower abdomen can be more than just muscle strain or aging. It could be a sign of advanced prostate issues. As the prostate grows or becomes inflamed, it may irritate or compress surrounding nerves and tissues, leading to deep, dull pain that doesn't go away easily, discomfort that worsens when sitting for long periods, sensation of pressure in the pelvic area. In more serious cases, especially if prostate cancer has spread, these pains may become chronic and increasingly intense. Many men chalk this up to getting older or bad posture, but persistent pelvic or lower back pain deserves a deeper look. If the pain comes along with urinary symptoms, fatigue, or weight loss, seek medical attention urgently. Don't ignore the signs. The earlier prostate issues are detected, the easier and more effective the treatment. Your health and your life may depend on paying attention to the silent signals your body is sending. If this video helped you, don't forget to like, share it with someone you care about, and subscribe to the channel for more health tips. Take care of yourself, and I'll see you in the next video.